guest. We are so blessed to have Dr. Terry Wood from Mustang, Oklahoma, here with us today. And he agreed to spend a precious hour with us so that I could ask him all the questions that you have sent me about IVDD. But before I'm going to ask the first question, I think it would be always better to just ask Dr. Terry Woods to present himself. Dr. Terry, go ahead.
Okay. Well, I grew up on a farm in South Dakota and ended up going to vet school or first school at South Dakota State University, and then graduated from vet school at Iowa State University in 1981. I was a small animal vet for about a year. Then I was a large animal vet for about 4 years, and then now I've been a small animal vet since then, moving to Mustang in 1986 and opening my own practice. It took me about 15 years, and that seems to be the time when most veterinarians reach an epiphany. Do I keep doing what I was doing, which legally meets the standard of care, or am I a little upset because I'm not doing as much as I should for the pets? And so that's when I started stepping out and learning and doing other things. And as far as intervertebral disc disease, basically what it is, it's the discs are the cushions between the bodies of the vertebrae, and the spinal cord sits in the bony canal just above that. The disc is made up of two layers. There's an outer fibrous layer and an inner jelly-like layer. And what happens is that sometimes that fibrous layer gets a little weakness in it, or due to trauma or something like that. And then one of two things can happen is that inner disc material can just explode onto the spinal cord, which is never a good idea, or it can just bulge up and push on it. Now, the two areas that it happens are in the neck and the upper lower back at the thoracolumbar junction. In the back, the spinal cord is a perfect fit in that bony canal. And so if you have that disc pushing up, it's going to impinge on that, and it's going to interfere with the microcirculation. And, it causes things from, it might be where you don't even notice it, or it could be just slight pain to severe pain to loss of nerves to complete paralysis and loss of everything. The other place it happens is up in the neck, and in the neck, there's actually a ligament that runs in the bottom part of that bony canal. And also that spinal cord is not a perfect fit. There's a little room for it to swell. So if we have a bulge up in the neck region, it will, instead of pushing right on the cord, it tends to be squeezed out between the bodies of the vertebrae where those nerves come out, which that's kind of an academic point because the same things can happen. It can be from, possibly subclinical to, minor discomfort to severe pain to very, very severe loss of function and paralysis. And, it's some clients are like, well, he's limping and showing deficits in his back leg. How can that be from a neck injury? And I said, well, ask Christopher Reeves if, a neck injury can affect your hind leg, and it can affect anything in the body because those nerves are coming through there. So that's the big thing describing the intervertebral disc disease.
The first question that I have here on my list from Diane, she asked, how do I know if my dog's IVDD is mild or serious?
Well, that's usually it, is, the severity of the clinical signs. And, when I examine the pet, I'll palpate the areas. And if there's a problem, I'll get a very, very dramatic muscle spasm underneath there. And like if it's in the back, a lot of people say, well, I went to pick the pet up and he nipped at me or he cried, and he can't jump up on the couch. Or if it's in the neck, I'll try to move the head and the neck and they just fight me. They don't want me to move it either way. I can always tell the farm dogs when they jump out of the pickup and their front legs hit the ground, they go, yep. And like, okay, until further notice, that's a neck problem until we look. But yeah, it's usually a loss of function pain. That's how you're going to know there's a problem. And, reluctance to jump on furniture. The other thing that we run into, people will say, well, they won't eat out of their dish, but if I hand feed them, they'll eat and drink. That's because it's very difficult for them to get down to the floor. And they go, I just don't understand that. It's like, I do. So that's, we can tell.
Yeah. Teresa is asking, when is surgery necessary and when is it not?
Well, surgery is a big decision. because it's very expensive. It's multiplied thousands of dollars. And the surgeons, at least here in Oklahoma City, they will tell you this is not a guarantee. We're going to get your dog back to work. And I've actually treated quite a few dogs that had surgery that were paralyzed, and we were able to get them back. So, you know, I I mean, to me, surgery is an absolute last resort. I mean, if the spinal cord like that, okay, yep, they probably need to get that looked at. But to me, it's just the last choice. There's lots of things we can do before that happens.
Mm. Stephanie was asking, what long-term supplements should I be giving my 10-year-old Frenchie for his IVDD to prevent relapse?
Well, there's not really a specific supplement. The main thing is just feed them a really good diet, exercise them, keep them as strong as you can be. Um, and that's about it. Because anybody that says if you take this supplement, it's going to help it or prevent it, that's not really true. I mean, I use a lot of MSM for things, and it's a great product. I use a lot of Lixotinic. It's got a copper in it that'll help stop any bleeding. But as far as the specific supplement, it's more about, just clean living and self-denial, eating a good diet, getting lots of exercise, moderate exercise. And if the pet is, likes to jump on the bed or the furniture, get them a ramp, get them some stairs, so that they don't have to do I always tell my clients, don't let them watch, the one where Mary Poppins jumps off the roof with an umbrella. Don't let them watch that movie, or they're going to try it. So that's the big thing. And then picking them up. When you pick up a pet that's had a problem, you get underneath their body, hold their head, because if you just pick them up by the midsection, they're going to be twisting around, and that twisting is the easiest way in the world to pop a disc. So just holding them very firmly, and so they can't twist around, helping them up if they need help, but try to get them used to stairs. And that's way more important than a supplement.
Yeah. Okay. While you were talking about exercise, we have somebody here who is present who was asking what type of exercise. The one we are accepting is dragging his rear legs. I would immediately think of being in the water, being in a pool, to
Right.
at least have something going.
Yeah, swimming is the best choice for that, because if they're walking with the tops of their feet on the ground, they're going to wear them out. And, I've had clients, well, we deal a lot with degenerative myelopathy, and I've seen them have some socks with some things that could help them do it. But yeah, you can't let them walk with the tops of their feet. But swimming is excellent, excellent. We have a park here in Oklahoma City called Water Bark, and they're very, very good. And I refer lots of these guys plus torn ACLs, and it's wonderful because the dogs, can do that. They're not hurting themselves, and most of them have a lot of fun doing it.
Anne is asking, what mistakes should I avoid at home with IVDD? Well, I think immediately of what you just said about lifting the dog, lift the dog correctly, make sure to have ramps and so on. And what else? What mistakes can she avoid at home?
Well, a lot of people want to take the same pain relievers that they would, which would include NSAIDs like ibuprofen or naproxen or something like that. And I do not. I have some ibuprofen if one of my helpers has a headache. It's like, take it and get back to work. I'm the best boss ever. But I don't allow it because of the side effects. It will tear up the liver and the kidneys. It'll cause bleeding. In fact, one of the ladies in my Sunday school class was taking a NSAID for her chronic neck pain and ended up with 3 bleeding ulcers in her stomach. Had to be hospitalized, get a bunch of blood transfusions. And it's like, that's why I do not use the NSAIDs. So that's the trick, is that, people say, well, I'll reach for some ibuprofen or Tylenol or aspirin and give it. And it's like, yeah, please don't, because the side effects and the harm is way more than the benefit.
Yeah. Sandra is asking, how long does crate rest really need to last?
Well, I always tell people that it takes about 3 weeks for that disc to heal. And once we start working with them, the most dangerous part is usually a few days into it, because they're feeling a lot better and they go, look, I can do a backflip off the couch. And it's, yeah, in the pike position with half a twist. It's like, no, please don't. Some pets, if you put them in a crate or like a gated area, they'll tear themselves up trying to get out of there. So some pets, I tell the owners, you decide, because if he's going to tear himself up in the crate, by all means, do not put him in there, because some pets do not tolerate being in a crate or a pen. So really depends on the pet. So, but it takes about 3 weeks for the disc to heal. And again, my goal, whether it's photonics, or because I will use some prednisone at times, and that doesn't interfere. That works well with photonics. I tell them, it's like, well, we want to take away the worst of the pain, but we want to leave a little bit. So when they decide to jump, it's like, oh, maybe I shouldn't. So that's the balance. Your tight wire you're walking.
And that's exactly now what the next question is about, because Greg wrote me and said, what holistic treatments help IVDD healing? So maybe
Um,
you can talk a little bit of advanced photonic therapy that you're all also using.
Yeah, I use, if it's not a bad one, if they're just a little uncomfortable, they get the lecture about, food and water elevated, restrict their activity for 3 weeks, get the ramps and all that. But if they're, any more serious than that, or the owner wants it, I definitely do the photonic therapy. I think a classic example, I'm like a second grader. I got a great story. Uh, a friend of mine was a vet in a neighboring town, and he was closing his practice, and he had this little 12-year-old miniature poodle that had quite a few problems with its back, and it had been on Previcox, one of the NSAIDs, for probably 6 or 7 or 8 years. And we met at a meeting. And he said, "No, I want to send her up there, and I want you to keep giving her the Previcox." And I'm thinking to myself, well, I always wanted to be tall and skinny, but guess what? Previcox and that, neither one of those going to happen. So she brought the dog up, treated it with the IMLI. The dog, I just euthanized her, and she had turned 18 years of age, and she did fantastic the entire time. I gave her no drugs, and every time I'd see my friend, well, you keep giving her the Previcox, and I said, no, I never gave her any. Well, she was in a lot of pain. How are you dealing with that? What can you do? And I said, I'm doing the photonics. She's doing great. The owner loves it. Dog loves it. I treat the dog. The dog goes to sleep on the way home. Everybody's happy. So yeah, that's my favorite. And of course, if people are watching TV in the evening, if the pet's where they can do it, they can gently massage a neck, put a warm pack on it, not hot, and just kind of gently massage the neck or the back. The pets love that. But yeah, the photonics, and we've had, quite a number of dogs that were completely paralyzed that are walking now. And we're not going to get everyone, but we're going to get the vast majority of them. And again, if we need to do some pain relief, I will do initially a decreasing dose of prednisone. If it would become a chronic thing, I will happily prescribe a narcotic. They don't have the side effects that the NSAIDs do, but I rarely have to do that. In fact, I don't even think I've had to do it for IVDD. But if I needed to, and the photonics wasn't doing it, that would be my next step.
Yeah. So in my case, with the 3 dogs, there had to be something genetic with those dogs, because they were 3 brothers and sisters, and they all had it. Only that with Tommy, his disc exploded.
Yeah.
So the vet said, I need to operate. We can't let the fragments there. I need to operate on your dog. And the other one, the sister, was also operated. But Tommy and Sheehan, they came first out of the operation paralyzed. And my
Yeah.
vet he doesn't want to put dogs to sleep, but he said, Eva, I can't do anything anymore. And I said, well, I'm not giving up. And I have the videos on YouTube with the advanced photonic therapy, and they both regained the possibility to walk again, and they lived for another few years. They were already old, and they lived for another few years. So I'm really happy. Now I got here a question from Ellen, who is asking, how can I reduce the inflammation naturally? Of course, with photonics, but what other ways does she have?
Yeah, the photonic therapy and the massage and the swimming, because I know years ago I was having some issues with my back, and a friend of mine uh, said, "Well, if you'll strengthen the muscles in your lower back, you'll never have to come see me again for your sore back." And guess what? That was probably 30 years ago, and I've never gone back to see him because my back's fine. I do the Roman curls at the gym when I go, and it really works them. So yes, if you can, strengthening the muscles is absolutely the way to go.
Christy wants to know, how can I manage pain safely without too many meds?
Well, yeah, that's, like I say, I will use a decreasing dose of steroids because I still remember the words of one of my professors that said the best thing about steroids is they work, and the worst thing about steroids is they work because it's tempting to use them too much. So if we do use them, very commonly we'll go twice a day for 5 days, once a day for 5 days, and then every other day only as needed. And with most IVDDs, you can take them out of the acute pain, rather quickly into the scenario. And definitely, I prefer the pills because we can control that. If you give them a shot of a long-acting product, you can't control it once it's in there, and that's could be a real problem because. Yeah, because the too much steroids will actually cause deterioration. Best and the worst thing about it. But that's I've probably had the best with that. And then the photonics, that's my go-tos. Yeah, because I try to stay away from the NSAIDs and the gabapentin and all that. I just don't do it.
Helen wants to know, what are the signs that show improvement or worsening?
Well, it's just their function. In fact, some of them, if they're paralyzed, I'll just try to get them to stand up. And I'll stack them up and say, okay. And when they reach a point where they can stand on their own and not fall over, hey, that's improvement. Or if they've been standing and then they fall over, that's a bad thing. But pain, if you pick them up and they're less painful or more painful, falling over, those are the big things you're looking for. They're going to let you know one way or the other. You'll figure it out pretty quickly.
This question, we already talked a little bit about it, but I'm just going to ask it because Jenny sent it to me. How can I prevent another IVDD episode?
Well, the idea is you try to do the best you can to keep them, from the jumping and the twisting and all that. And it's basically impossible for some pets. The owner says, I don't know what to do. They love to run Zoom meets. They run the fence with the neighbor dogs. They do all this and they do that. And it's like, well, have a long chat with them, take away their internet, do anything you can do. It's really hard, but just trying to avoid known problems. It might be that if there's a hole in the fence and the dogs are fussing at each other through the fence, fix the hole in the fence. Just do whatever you can do. And if they're used to just running and jumping up on things, get a ramp. Those are the big things we run into. And some pets will use ramps and they'll use stairs, and others, so I just say, well, put something soft around your bed. Maybe they'll land on something soft because they refuse to use the ramps or the beds. But, again, good diet, good exercise, walking, even on a preventative basis, doing the swimming, that'll help build up the core muscles. And again, to me, the real strength of this is the core muscles. If those muscles are strong, and they don't do anything stupid, the chances of you're going to minimize your chances for that.
Carolyn wants to know if dogs can live well again after an episode of IVDD.
Sure. Yeah, we have lots of them that have had episodes of it and did just fine afterwards. You're always a little bit nervous. It's like, you just jumped off the footstool there. Are you okay? But yeah, we have a lot of them that are fine. Lots and lots and lots of them. Yeah, lots of different cases. I mean, we had one, it was a little dachshund, of course, and the owners lived by a lake and they drive a golf cart around, and he saw a squirrel or something and jumped off the golf cart onto the concrete and ended up paralyzed in all four legs. And it took us about 4 months. We got him walking again.
Yeah. Wow. Sarah wants to know, what should I do if my dog suddenly can't walk?
Immediately take them somewhere. Yeah. Even if you have to go to the ER and they want to, give them, because they're going to need to be evaluated as to how severe is this? Because, different pets, just like people, some pets can be grievously injured, and you ask them, hey, you don't look so good. How are you feeling? I never felt better in my life. Oh, is that why you're missing one leg? No. And then other pets, have a little thing and they're cayenne. So, you have to kind of know your pet, but if they're suddenly like that, they need to be seen by somebody right away. And even if they go to an ER or a urgent care and they do, say they do the NSAIDs and the um, gabapentin and whatever, get them to somewhere else as quick as you can. But the timing is of the essence, because that's one of the big things is they tell us that when that disc pushes up on the spinal cord, it's going to shut off the microvasculature to that spinal cord, and injury, very sometimes irreversible damage, can happen in as little as 30 to 45 minutes. So, doing what you can do right away is crucial for something like that. Yeah, it's like, don't wait over the weekend. Take them somewhere right away.
Does age or breed change the prognosis?
Yeah, if it's a dachshund, we know it's going to happen. It's just where and when and how bad. And of course, the older ones, because they're not moving as much, and they trip and fall. I'm getting to the age now. If I go to the doctor, it's like, well, have you had any falls? Why did you ask me that? I'm just a pup. But they do. So yeah, the older ones, I think, are a little more prone to it, because the younger ones, they're about half rubber band. They can do stupid stuff and survive it. But the older ones, we break easier and it takes longer to heal. And then the long body breeds are definitely much more at risk.
As an owner, what's the single most important thing that I can do to help my dog heal?
Uh, well, just getting them good care, whether it's a short term of steroids, or whether it's photonic therapy, or whether it's the water therapy, or, getting them used to the, um, the ramps and the steps. But I think it's just like, anything else. The pets really depend on us, and just being there and helping them out. And a little trick that we'll do that, because just being there and being a good owner, they love that. That's what they want. And if the pet's having a hard time walking on his back end, maybe even have a hard time eliminating, you can buy commercial products, but we call it Zal trick. You can just get a long towel and put it under his belly, on the back, in front of his back legs, like when you're kids and you played wheelbarrow, and hold that so you don't hurt your own back, and take them out and let them walk around on that, even if they can't use their back end at all, and you end up having to get one of the carts. Take them out and do the towel trick with them. Does two things. It keeps them moving. Motion is lotion. You got to move. If you quit moving, you're going to die. Um, and it also puts pressure on the bladder and the bowels, and it'll help them to eliminate, because a lot of them, they may have trouble if it's bad enough that they can't do that on their own. So, that's a big thing. Massaging while you're watching TV, doing the photonics, all that, swimming.
Mhm. Now, when Tommy was the first one in 2017 who got operated, I bought a specific harness for his. So all my dogs, rescue dogs, have a harness for the front, but I bought a special harness for the back, so where you put the two legs in, and it's a lot easier to
Yeah,
carry
right.
because these dogs were 70 pounds.
Yeah.
So if every time I have to lift them, it's a lot of work and it's a strain for ourselves. Absolutely. I saw here a question. We've already partially answered it. Is acupuncture, laser therapy, or photonic light therapy helpful for IVDD?
Oh yeah, absolutely. Yeah, I use it. I've used it for quite a number of years now, and that I wouldn't be able to treat them effectively without it in my own. I just wouldn't do it.
Yeah. So when was it again that you worked together with Dr. Brian McLaren? That was 2003, 2004? When was
Yeah,
that?
he actually spent 5 years here in Oklahoma City, and I spent 4 years working pretty closely with him. He actually sponsored one of our local veterinary meetings, and to be quite transparent, I thought that people that did stuff like this should be locked up somewhere. But I heard him, maybe it was an Australian accent. I don't know. In the movies, Jesus always speaks with a British accent. So, okay, is that Jesus up there? Or is that Dr. McLaren? But, I heard him talk, and he just had story after story after story. And I had one of my helpers with me, and it's like, if this guy really can do that, I'm missing the boat if I don't learn how to do it. So afterwards, that was on a Tuesday, I approached him and I said, could you come to my clinic on Thursdays? I'm closed on Thursday afternoons. And he said, sure. And so that started the relationship. And yeah, it was, I wasted 1 year while he was here, but I thoroughly enjoyed it. And it was a wonderful, wonderful time. I miss him greatly.
And so do I. And in April, it will be 10 years that he passed away. So time goes quickly, but we still miss him. Absolutely. I got another question here. What role does diet play in spinal health and IVDD recovery or prevention?
Well, I think a lot of it is that because a lot of diets cause inflammation. And when you're dealing with this, you've got to be OCD about doing anything you can do to reduce inflammation. In my practice, I recommend grain free. I know a lot of people say the DCM thing, but taurine is not a specific an essential amino acid for dogs. I don't remember the last time I've diagnosed a case of that, and I see a lot of dogs, and I try to get everybody on that. And as an example, we had a couple of years ago, we had quite a number of our clients go to Italy on vacation, and they didn't ask me. I was a little upset, but anyway, I got over it. So if you go to Italy, you have to ask me, and I'll probably say I can't go, but you need to ask.
Okay, I
They,
will.
several of them are gluten intolerant. They cannot eat bread or pasta here in the US. And when they went to Italy, they ate it 3 and 4 times a day in amounts that would have put them in the hospital or in the graveyard. And they were fine. They had no symptoms. And why? Because the grains that we get here in our pets kit are GMO, which they're a genetic nightmare, plus they're Roundup ready. And Roundup glyphosate is a proven carcinogen. So if the wheat we had here, the corn, wheat, and soy, if it was non-GMO and it wasn't full of Roundup, it would probably be just fine. But that's not what we get here. And then as far as proteins, the two we've seen the most trouble with are chicken and salmon. We have a lot of pets that if we get them off the chicken and salmon, their skin clears up, they stop having seizures. Then it's a really good thing. But yeah, I think the diet is huge. To try to reduce the inflammation, and that's I think it's often overlooked because the gut, 70% of immune system's in your gut, and if you're giving something the pet's allergic to, you're going to sensitize that immune system and make it react, and you don't want it. You want it de-reacting, not acting.
Yeah, absolutely. Next question that I can see here on the list is, how do stress and emotional state affect the recovery in dogs with IVDD?
Well, that's really important because they follow us, and even other pets. There are times when I have a dog or a cat in the exam room, and the owner is really overreacting and very upset. The dog or the cat's fine, but when they see their owner acting like that, they start getting very upset. I've had to ask owners to go sit in their car while I got their pet examined, and they some get offended. It's like, look, I'm here to do my best job taking care of your pet. Your pet is very locked into your emotions, and you're losing it right now, and the pet's going to lose it. And I want them happy. I don't want them like that. So you need to support them just like you would a kid or a toddler, and play games they can play, give them attention. That's so important, absolutely, because I know years ago we had a dog that had a type of mange that was it was could transmit to people, and I said, you need to keep the kids away from this dog because I don't want them getting this while we treated it. Well, it was like a year later, and they came in and they said, can my kids touch the dog? The dog's really upset because nobody will pet him. And I go, of course you can. The mange has been long gone. Yeah, because they react. They need that interaction, whether it's from a pack or their owners. They absolutely need that. They need good interaction. And if they don't get it, a lot of things happen and it's all bad.
So, interesting question here. Can imaging like the MRI, the CT, or the X-ray change the treatment decision? And when is it really needed?
Well, I uh, I'll try to do this correctly. The Western thought is that function follows form. In other words, if it looks bad, that means it can't work. The Eastern philosophy is that form follows function. In other words, they don't care what it looks like as long as it works. What I find is that the higher level of imaging that are done is going to lead to more dramatic interventions. And again, if the surgeon that's doing it here in Oklahoma City, at least several of them guarantee your pet will be paralyzed when we're done with the surgery. We just hope it can come back. I mean, I've had clients tell me that because I refer them if they want to do it. But so and I read a study a long time ago where it was a human study where it was people that had back pain, and what they did is they did a meta-analysis on the people that just got pain relievers and warm packs, and that was it. And then the people that got X-rays, and then the people that got MRI or CT scan, and then the people that got all that plus discograms. And the assumption is that the higher level of intervention would mean they had better rates of success. And in reality, it was just the opposite. The more they found, and the more they did more interventions, and they ended up having much worse outcomes. A good friend of mine is a retired gastroenterologist, and he was talking about as the CT scans and imaging became prevalent, he said, we were doing all kinds of nonsense because, oh, well, here's the problem. It looks bad. We've got to do something. And you have to be very careful with the imaging, because I think at times, does it need to be done? Absolutely. But just because it looks bad, is it like with your pet? Okay, well, I did the surgery and gosh, it looks terrible. You might as well just put him down. It's like, well, I really don't care what it looks like. As long as, like I say, they're not like that, I don't care. We've got a chance to get them back. Well, it doesn't look very good. Doesn't matter. Let's make it work. It'll form what it needs to work, and it might not look pretty, but we're not giving style points. We just want them to be able to walk and be pain free.
Yeah, absolutely. Are disc problems always painful, or can IVDD exist without obvious pain?
The milder cases really aren't too painful. And, if somebody does get an x-ray, they might see, some calcified disc, and, they might go, holy cow, this dog's been, this looks terrible. He must have been having all kinds of trouble. The owner says he's never had a bad day in his life. He jumps off the couch and does flips. So, they can definitely be subclinical at times. Absolutely. But again, I'm not going to worry about that if they're functioning. Now, when function is affected, or if they suddenly go down, something's got to be done right away. But yeah, they can be non-symptomatic. Absolutely.
How long does nerve healing usually take, and what timeline is realistic?
Well, the disc itself will usually strengthen in about 3 weeks. If the nerves have been really, 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 hurt, they can actually they resolve at about a millimeter a day. So it can actually take months, for some to come back. I had an example. A friend of mine had a Rottweiler he weighed probably 150 pounds. He's a really nice dog, but he went out to meet his daughter at the bus stop, and a police officer drove by and thought the dog was attacking the kids. So he jumps out and shoots the dog with his 357, and the bullet hit his first rib. And on a 150-pound Rottweiler, it's kind of curved and really stout, and it glanced off the rib and broke into 5 segments, but went into under near his armpit where all the brachial plexus is, and the nerves weren't severed, but the shockwave destroyed the myelin sheath. And when I first saw him, that limb was completely dead. He couldn't do anything, and the guy said, "What are we going to do?" And I said, "Well, if the nerves aren't severed, it'll heal, but it's going to take a long time, because it's going to take 1 millimeter a day for that thing to get better." And it took about, oh gosh, I think 6 or 7 months. And the dog, got function back and recovered. But unfortunately, in the process, he thought there was ants crawling in his legs, so he chewed off 3 of his toes in the process. But he was functioning. So the nerves, even if they're grievously damaged, there is a chance they can regenerate, but it's going to be very, very slowly.
I see another question here coming up. How can we help anxious or depressed dogs cope with the restricted movement?
Um, well, I think that's where, just being a real attentive owner, if you can, take them on walks. And like I say, even if their back end is paralyzed, get the harness you were talking about or use a towel, take them out in the yard, let them walk around, let them sniff the air, check the news that they get when they sniff the air and, take them out. I mean, I've seen people take them for a walk in the baby carriage, get them out and keep them active just like you do with people. And try to do interact with them, a game that they like, or just let them know that they're not abandoned and alone. And pets will respond to that. But yeah, you definitely have to do that to keep them occupied and just be a really good pet parent to them.
So Kathy here present is asking, what if my Doberman thinks he can't walk due to pain? I don't want to cause him more pain by taking him for a walk.
Well, yeah, we just need to do our best, to try to get that pain under relieved. Again, whether it's a combination of, some steroids, some warm packs. Um, but yeah, and again, you kind of have to know your dog because some dogs can be in a lot of pain and won't let you know. Other dogs really aren't in that much pain. You don't want to disbelieve them, but the goal is to try to get them as active as you can, as quick as you can. And even, if it's his back end, if you can get, one of those harnesses that gives them good support, we know we're not going to be twisting him around. That's going to cause more damage. So, I'd give him some prednisone and, give it maybe a half hour. And it's like, okay, we got to get out and we got to get you moving. Because if you just sit there, that's no good. So yeah, I don't want to torture the pet, but I want to get them moving as quick as we can. Um, and our goal again is to try to keep them supported as you can. So as they're not twisting and they feel supported again, whether you're picking them up to make sure you've got under their body and their head so they can't twist or, if it's a harness. And then, especially if one's really having a tough time, you'd have to lift them up and get them into a car and get them to the pool or whatever. But, try to get them active as quick as you can.
Otherwise, they lose more and more muscles, and it becomes even harder and harder to get them back where they could
Right.
be. Yeah, absolutely. Well, I have one last question here. And where was it? There it is. What are absolute red flags that need action?
Okay. Yeah. If your pet is fine, and they're running around the yard, they ate, they drank, they used the restroom, they jumped up on you, they jumped on the couch, and if you all of a sudden they they can't move their back legs, they're dripping urine and stool all over, and they're crying, and you go to touch them and they try to bite you. Oh my goodness, that is a red flag emergency. You've got to move, quickly, because that means you've probably had an explosive release of the disc material and need to get some help really quickly.
I see. Oh, hold on. We have another one coming in. How often is the frequency of when my dog has had one IVDD episode that he may have another one? Do you know the frequency?
It's not like seizures where we can see a definite pattern. Um, we have pets that have had sometimes a really bad episode and they never have another one again. And then you have others that you know are doing things they shouldn't do, and we see them on a fairly regular basis. And it's like, okay, we're another day older. Did we learn a lesson from the last time we did a backflip off the couch? And
Yeah.
some pets are like, well, I thought it would work this time. It's like, no, it didn't.
Well, it didn't. If
Yeah.
we're thinking of that dachshund who is only a year and a half old and already has his first episode, what's the future like for such a dog?
Well, you just have to do everything you can do, to try to keep it from happening. But genetics are working against you. Like I say, I don't know why they didn't get a belly wheel, because boy, that back, it's just a nightmare. But just trying to, And again, it goes back to, putting him in a cage or putting him in a pen. Some pets will absolutely self-destruct if you do that. I think it was some racehorses that broke their legs and they did surgery and put them in a cast, and the horse just bang, bang, bang.
Yeah.
And they end up having to put the horse down because they wouldn't tolerate the cast or the surgery. Unfortunately, some dogs are like that. But even if you do everything right, things can still happen because it's real easy to understand. Like if, say, the neighbor Chihuahua starts a fight with the neighbor's Great Dane, and the Great Dane says, "Look, I've had enough of you," and he grabs him and he shakes him like that, and he gets like 3,000 whiplash injuries. Okay, I can understand why his neck and back are out, but there's sometimes they didn't do anything wrong. It just happens. In fact, we have I guess I'm picking on Chihuahuas, and it's happened quite a number of times where somebody will call, and the owner is going, and I hear a yay 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 in the background. Well, what happened is that the Chihuahua was taking a nap. They woke up and they popped a disc in their neck. They didn't do anything wrong. And the owner walks over, puts their finger under their chin and lifts up and goes, "What's the matter, honey?" And that's when they get bit. It happens. It really does happen. And so, I giggle at things I shouldn't, but it doesn't take a big bad thing. I mean, it can literally just happen. It happens with people. You can just turn a certain way and bang, there you go. So it's easy to understand when they've been hit by a car, mangled by a bigger dog. It's easy to understand why it would happen, but sometimes it just happens, and we can't understand or explain it. So you just do everything you can do a good diet, keep them active, try to keep them from jumping. That's the best you can do. But yeah, because things can happen. Even if you do everything right, things can still happen.
So for you, what are, let's say, the three top breeds that you've seen it most with the IVDD problems? So
Uh,
besides Huns and which
yeah,
else?
dachshunds and dachshunds, yeah, they're by far the worst. I've seen it in probably every breed that's come in the door, but
Okay.
dachshunds by far and away are the worst.
I see that my Kahuna Rescue has posted in the chat. Would a wheelchair temporarily be okay, or does this interfere with recovery?
No, I think it can be very helpful at times, except I've had my feet run over so many by the wheels on them. It's like, I don't know if that was a good idea or not. But no, the chairs can be a big help because, again, it keeps that front end moving, and the more stimulation they can get, absolutely. And you hope that it's just going to be a tool so they can get recovered and not need it anymore. But absolutely, it's a good thing to do because we need them moving, we need them mobile, and that allows them to move around when you can't actually walk them with the harness or the towel. So absolutely, that's a great thing to do.
And then she also asked, what is that treatment you used with the dog? I couldn't catch the name. We were talking about advanced photonic therapy. That's where Dr. Terry Wood and we use a very specific red light to stimulate acupuncture points. So that's what we are using every day. And I think that's it. I don't see any new question coming in. Any last words, Dr. Wood?
No, I just and it's kind of funny, but you were talking. There was a question about attitude and all that.
Yeah.
I think if we expect the best and, for whatever it stands for, I think you're going to have a better chance of getting the best. If we're just worried and we don't want to do anything, we don't want to throw a ball for our pet because we're worried about, hurting him, throw the ball, have fun with them, have a great attitude on life. Your pet's going to pick up on that. And, you're that's the key is just do everything you can, feed them a good diet, exercise, play with them, make them your best friend, which they're supposed to be. And then if something does happen, you're going to be in a much better starting place because they're going to trust you and go, hey, they're trying to help me. They're trying to help me get better. But yeah, it's you can't be afraid of it because if you are, your pet is going to know it. It's kind of like when I was a large animal vet. I had one fellow with his horse, and he said, "Doc," he said, "this horse scares me And I said, what are you talking about? That's one of the nicest horses I've ever worked on. And he goes, well, he knows what I'm going to do before I know what I'm going to do. Like, well, don't be an idiot. Do what the horse says. You got steered you right so far. There's that connection between pets and
Yeah.
horses and dogs and their owners. And, it
Yeah.
needs to be a good one. You need to just, be happy, be good. And, don't be fearful of it. It's like, oh, he's had one. He's going to have another one.
Mm.
No, just, act like he's not going to have another one.
Absolutely. So how can people find you?
Well, probably the easiest way, I've got a website, Terry at terrywooddvm.com, and that would be the best way. And yeah, we'll do our best to help everybody we can.
And I already asked you this before the start of this meeting, and I'm just going to ask it again for those who are present. Can we have you back next month for another hour?
Sure.
Another topic, another hour together?
Yeah, that'd be great. Yeah, we love to do it again. Because we get people literally coming from all over, and it's like one time somebody called me at home, and I told them, I said, well, I'm sure there's some good vets between here and there. Why are you driving that far? And my wife said, did you try to just tell them not to come in? I go, yeah, but it didn't work. They're coming anyway. So, and she said, look, if they want to come in, that's fine. Just don't try to discourage them. But yeah, people are really, there's much more of a body work. I think an example, the Chinese 5,000 years ago said your body's energy, your chi, comes from your gut. And it would be pretty easy to dismiss. It's like, well, what did they know? Well, guess what? The biggest topic of health is now is your gut microbiome.
Absolutely.
If you got a good gut microbiome, you're healthy. And it's like, hey, they were right way back then. What else did they do right? So, yeah, I think that's the thing. There's a lot of things to be addressed, but yeah, and that's why I'm happy to do it because and more people are, even in my extended family, they've laughed at me for the things I do, but all of a sudden it's like, how do I do that? Where do I? Okay, yeah. So, it just takes time, but yeah, people want it, and I'm happy to do my part. If that helps, I'm happy to.
Absolutely. Well, Dr. Terry, thank you so much for being here with us today. And for all those present, thank you again for all the questions that have been sent in. I will make sure to put the recording on, bye Whitney, to put the recording on the YouTube so you can have a look back at this video when you want to have more information. Kahuna, yes, there is a free ebook about the red light acupuncture that you can download. And yes, Whitney is one of those who use it every day, just like me with all the rescue animals that I have here. Thank you, and we'll see you again next time.
Thanks for
Bye,
having me.
everybody.
Bye.
Bye.